like, and as a nurse, like you're everything. You are the therapist. You are like, there's times when you might be, let's say you're drawing blood, but as you're talking to your patient, you see that your patient is showing signs of suicidal ideation or, whatever. Like now there's psych issues that, like it does make a difference to have a background with a basic foundation. I don't think that you necessarily need a year.
Like those,
wild.
all those numbers when it comes to like,
That's
you need 6 years, whatever.
But
like
you need a little time.
You know when you're gonna. I feel like you'll know when it's time to leave.
Yeah, that's for sure.
Yeah, you'll know when it's time to leave.
That's for sure. But having that background definitely makes a difference.
Yeah, your assessment skills are sharp, like so sharp. Like even going into a patient's house, like by the way that they're breathing, by the way like they look, like, and that's all you're learning that from your hospital.
Walk and the door,
how they take off their clothes.
Yeah, and you know how I learned that when I would come in and like I have a district of 6 patients, and I come in, hey, Mr. Sosa, how are you? And you can't answer me. Versus you answer me, but like you sound a little like whatever, not like so I'm just like, all right, let's. How was your day? Like, what you do today? Like, and I'm just talking to you like a normal person. Like, you wouldn't even know that I'm sizing you up to see what you can and can't do.
Exactly.
As I'm talking to you, I see your hand is shaking and you're trying to grab, whatever. I also noticed the dentures here, so I'm like, all right, so let's think of diet. Like, so your
mind is just like running.
Working, and you doing this with 6 people, like, and you're constantly getting people, whatever.
Yeah,
that foundation.
Not to mention all the other, like you helping your coworkers patients, like you're answering your phone for this family and that family and a doctor and
dealing with family that's in the home. You know what I'm saying? So like, it's a lot. I would definitely say you should get a background in med surg, like even if it's just for a couple.
I know,
of
like
months.
Now the trend is like, go
just into a specialty.
Go to I mean, I don't know. I think I'm not gonna say it's not a good thing to do, but like you're gonna lose some stuff.
That's for sure. I had a patient a couple weeks ago. I had a patient in labor and delivery. She does have a history of anxiety. And okay, I don't really shy away from those patients like at all. So I'm in there, but because I know she has a history, the first thing I say to her, like I obviously introduce myself, and as I'm talking to her, like I'm just saying, like, just by the way, I know that you have a history of anxiety. I'm gonna let you know that we already there's a social work consult. So I'm gonna inform you and let you know, because one of the things just in being in med surg, I already know it. When the doctor says something like, oh, I put this order in, but they didn't say nothing to the patient. So now everything comes as a surprise. And now it leads into a different situation. So I'm like, I'm going to nip all those things in the bud. I'm going to tell you, like, somebody is going to come and see you as part of your mission. So let's talk. What do you know about labor and delivery? Tell me what you know. And I'm going to assess to see what you know. Okay, you know
where your
0
deficiencies
things?
are,
Cool, I'm going to start from the basics.
Because that's where sometimes anxiety starts from that, not knowing.
Exactly. And so, but I promise you, if I did not go into, if I was not a med surg nurse before, if I didn't work as an LPN before, and I'm like in my specialty, I would have like, okay, I got reported, like my patient has anxiety. All right. I would have introduced myself. If you need anything, hit your call bell, blah, 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 and I would have left, and that would be it. There's no, I would not be able to build that relationship or dispel and try to prevent you from having a panic attack or, and all those things I learned as I was going on. Like I've had patients that would be yelling at me, like, and I didn't realize that you're upset because the doctor told you were going to be discharged today, and I'm coming in fresh off, like, you're probably gonna be here for 3 days. You have a scan that you got to do tomorrow morning. So I'm gonna change your IV because it's been a few days now. Like, and it's a big surprise. If you take the surprise out of it, the more you let your patient know. I might be in my room for 30 minutes, and while other nurses may be in their room for 2 minutes to introduce themselves, but guess who has the better outcome and less likely to be, not to say I'm preventing, but I'm preventing you're doing, an exacerbation of anything. And it's a stressful situation being in the hospital.
So anxious patients, like off rip, I know from anesthesia wise, they're actually harder to manage.
They are.
Because why? You're like it's like you could imagine a child fighting sleep. That's how they are.
Yeah.
Like I'm pushing, like you're giving them as you're looking at them like, damn, like,
they didn't touch you.
Yo, why?
Because your body's literally fighting you.
There's gonna be that point, that cutoff point. You give a little bit too much, and it's like boop. And it's just like a bottom out effect.
Yeah.
So that's why it's important to kind of like start like building this. I do exactly what you do. Like, I speak through everything. I'm like, yo, you're gonna get into the room. The room is gonna be cold. You're gonna have a million people telling you all these things. I'm gonna be at your head of the bed telling you, like, I'm gonna try to walk you through these things, but I'm not gonna be able to walk you through everything. But I'm also, the minute I get you in the room, in the back of my mind, I'm like, I'm giving you something for your anxiety.
Yeah.
Just to kind of calm this whole experience down for you and make it not enjoyable, but like you're not freaking out.
Right.
And like even
crazy.
your back, like, so the background, I've watched this one doctor, like just his mannerism. I had to end up asking him, like, yo, what did you do before you became a doctor? He was in the hospital, like he did LP and he did nursing. I'm like, oh,
makes sense, because you can always tell. I was
like, yo, that's why. I'm like, oh, this makes a lot of sense. Why? I just have this feeling that you just like, you're carrying one, like you just different.
Yeah, the way that you talk,
you're
always
so
tell.
different.
You can always
and
tell
it's a good
works.
different.
Yeah.
It's a wholesome different. Like, and I'm like, man, like that was just from, I kind of felt there was something more than just you being a doctor. Cause like, I know that ain't it, son. Like that, yo.
We're down.
Yeah. Bedside manner, how you talk to your patients, all that stuff is just like on point. Like there's no way.
Yeah.
Or your mother was a nurse.
Yeah.
Like,
and you have that compassion.
Yeah, like that is important. A different. Oh, that's different.
It's important. It's definitely important. Like, and I do find the more experience you have, and not just in the sense where like even the years, because you could be working in nursing for 30 years,
and it doesn't have to be that way. Yeah, you can still be me.
Yeah, right. Like, you can, but like it's just a different. It's a different type of person that kind of went through things and, you know, adapted to it and use those skills still and to manage your patients. But yeah, absolutely, I would say anxiety for sure, and I would say, you know, obviously, in America, you know, anxiety is really prevalent in a lot of people. You can have underlying anxiety, you know, you're on medications and whatever. Just speaking from a labor perspective, when you are anxious, it's like you are fighting labor itself. So it takes longer for you to progress. Yeah. It takes longer for you, like, you
that
know,
could cause you
like,
guys to get a miscarriage too, right? If it's
I'm not sure about. I have no. That's somebody should look that up and
I think I've heard like I've heard
someone.
Like women that have like, are they in a bad like situation with the father to be?
Stress. Yeah,
that
of
could
course.
cause miscarriage.
Stress can definitely. So yes, can anxiety exacerbate stress and lead to that? Yes, for sure. But in terms of like, you have a laboring patient full term, like let's say no other history, but just anxiety, it's harder. I've had patients where, let's say the tracing wasn't good and now we end up going to an OR to do a C-section and they're panicking. Now it's normal to have general anxiety in general because it's surgery. It's something that you weren't expecting. But I've had patients like, you know, go into the OR and now they have to be on the journal because like they're panicking almost like so much that there's nothing like
hormones that are released. They're on 1,000.
Yeah.
On 1,000.
That's
like if you can't like control, like if you can't find an effective way to kind of like, you know, control that, like, yo, it's crazy. Like how like anxiety and just like that could lead you to like, it could even change your anesthesia plan.
Yeah.
Which is wild.
Yeah, it is.
If you don't control it early.
Yeah, it is. But to me, it always helps when you have a provider, either knowing your doctor, like really truly knowing your doctor, knowing what hospital do you go to, because that does make a difference. And having you know, a team or even just your nurse, your even PCA to have like a good experience and have like a literal caring spirit
and realistic expectations too.
That's going to be real with you. That's going to be honest with you. I'm not going to lie to you. I'm going to tell you what to expect, just because, you know what, I always look at my patients like this is probably your first time in the hospital, and I can identify with how you might be feeling. Even though I see this all the time and every day, whatever, this is your experience.
Unique experience.
I'm gonna walk you through it. I'm not gonna go at your level, and I'm not gonna talk to you with medical jargon. I'm gonna talk to you how, like, you could be the chief of anesthesia, and I'm gonna talk to you like you know nothing about nothing.
Yo,
like,
I've watched a doctor who is not of Spanish heritage, like white. And learned his little medical Spanish, consent a woman for surgery. So, and tried to ask us to co-sign. I looked at him, I'm like, I'm not co-signing and it's not my patient. But you know damn well that's inappropriate. Like you
Right.
don't do that. Like you are not like you're not native. Like you don't even have a Hispanic background.
Right.
Like your Spanish is like it's cool, it's popping, but you need to ask her to call, like who can we call?
Use a translator.
And also who can we call to like, cause she looked anxious. I'm like, yo, is there someone, who is there somebody that we can call that will like make you feel more comfortable making this decision?
Yeah.
And she was like, yeah, call my daughter in, I think her daughter was in Puerto Rico. Call the daughter in Puerto Rico. Yo, the word, like, it's like night and day, the conversation.
Yeah.
Night and day.
Yeah. That was grossly inappropriate.
Yeah. And it was kind of like, yo, and he just fought us, like, got like nursing administration for the night. I was like, yo,
crazy.
You could call the police.
Yeah, right.
Like,
you can call whoever
you could call whoever you want, bro. Like you
here.
cannot, you cannot do that. That is like inappropriate.
Yeah.
You don't know, like how did you miss the fact that like she's anxious. She must have kids, right? Like it's kind of context clues. Like, yo, you're not Hispanic. This Hispanic woman, you know, cultures are different. Like this is surgery. Like. That's crazy. Can you help her out? Yeah. Like, don't speak for her.
Yeah.
Help her out. Help her communicate with someone who's going to settle her nerves. Have her actually understand what actually is going to happen.
Right. You're trying to do it to get to the so you can
finish
and
you're trying to, but like you're not even understanding. Yeah, I'm like,
it's still a person.
It's a whole entire person because you're like, God forbid something goes left.
Right.
I hope you're that same person.
Right. Right.
Right. I hope you're that same person.
Right. Or think about it if it was you.
Yo.
If it were you or if that was your mother.
I would never, I would like that like creeps me out. Like that gets me scared, to be honest with you.
Yeah.
And patient, am I going to be around? I'm like, yo, I hope so. Because I'm not God. And I pray that like, yo, everything goes as planned. Like I'm going to be on my P's and Q's. Like, because off rip, I'm always on my P's and Q's. Right. I want you to have a good outcome.
Right.
But yeah.
Is there anything that you feel like you would change about nursing in general? Does it have to be?
Man.
Or
I feel like we need to get back. No, it's not 3 things. We need to get back to basics, yo. I feel like we're losing. We're not pride. Like we're not. We don't take pride in our work like we used to. Like on the anesthesia end, we always have like these like little mini battles, like my hospital system like verges people like like, oh, receives patient with IV out or blah blah blah. I'm like, yo, what does that do? Nothing. Like, why don't you make sure your IV works before you send a patient down? You know they're gonna use it. You're the advocate.
Receive patient with IV out is like
yo, they've sent us patients. They sent us an HIV patient to endo with no IV.
Damn.
Yes, and I was like, yo, that's mean. But am I gonna sit here like, I was like, I'm upset because I'm like, yo, you set him up for failure and you set us up for failure.
Yeah, right.
So like already like, it's 2 negatives. Like I'm not gonna waste time. Yeah. Oh, I'm gonna verge you for what? What are they gonna do? Like we just need to be more prideful over work. We know like if you don't want to do IV, like yo, call the IV team. Find somebody. Yo, find a friend. Call a friend. We all do that all the time. Like take more pride in our work.
What is verging?
Verging is like, it's just like a little, I don't know. It's just like a wrist tap. Like hey, like identifying something that went wrong, and just like kind of like, I guess they use it for their bigger data to collect bigger data to see like, okay, why does X, Y, and Z happen at this time, at the same frequency, and like blah, 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 and try to develop a plan to kind of like prevent it from happening. So
it's almost like a
yeah, but I'm like, we don't need all that. Like just like we all know, like, yeah, we all know, because nothing comes out of it. It's like you're just go back and forth verging. I'm like, yo, we need to just get back to basics and take more pride in our work. Like we can't, like nursing is a special, like what we do is a lot. It's a whole lot.
Yeah.
But like we cannot like do it without caring. You know, like we just need to I feel like we just need to take our like take more pride in our work.
Yeah, I agree with you.
Because like on the other end, like I have to. Oh, the nurse is like I'm a nurse.
Like, I'm a nurse.
Although I'm a CRNA, like yo, I'm a nurse. Like I remember my floor times. I remember my step down times. I remember my ICU days. I remember that time. Like I remember that time. Like I actually like did those times like willingly, and I wouldn't not have done it. I would have done it again. But yeah, we just got to be more prideful in our work.
If you, let's say, were not a CRNA, what would you want to do in nursing, or would you want to do something else completely different? If you
physical therapy.
Really?
Yeah.
Why? Why
PT? Work for my favorite team or something like that.
Oh, like so sports?
Sports. Sports. I would have done something to do with like something to do with sports.
Okay.
Yeah.
What's it like working in the Army?
It has two sides, reserve side and like active side. It's been interesting. It's been fun. Some aspects of it's fun. But overall, like it's been okay. Like I'm not getting what I wanted out of it, but it's more so me like pushing the buttons more.
What is it that you want to get out of it?
More medical missions.
Okay.
Like really more medical missions. That's like the biggest thing.
Do you think that's something that will ever happen or no?
Yeah, I think I can make it happen. Yeah. Okay. I think I can make it happen. But it's a different side of nursing. That's what I wanted. I wanted to see that side of nursing. It opened my eyes to, like capabilities, like and all these different gadgets that are that we use, like on like during wartime and even not wartime. Like ventilators could be like this small.
Really?
Yeah.
I know that.
Yeah, it's pretty cool.
Oh wow.
Yeah.
All right.
Just how they like how they manage, how they, triage. Like what they're using to recover patients, like their blood ratios, like all this stuff. Some of the things that are ingrained in nursing now is some of it comes from like the Army.
Okay.
Like how like whatever like they ran an experiment or they saw like, hey, giving whole blood versus not whole blood is good in this situation, and this is why. Like in these case scenarios that they build, and some of these come into practice like and are like standards.
Wow.
So yeah, it's just a lot of learning. I just like learning. I just wanted to see what it was like on the other side.
Oh, that's pretty cool.
Yeah.
All right, last question. Maybe not last, but kind of like 2 in 1. Okay. In terms of CRNA bag, all right. One, in your opinion, what's the best state to work in as a CRNA with the biggest bag that you know of?
Biggest bag.
Opinion.
Being a locum CRNA. Locum is a is your how do I explain? They're traveler.
Oh.
Yeah.
Okay.
Like traveling CRNA.
Okay.
That's how you get the biggest bag.
Okay. All right. Now
the biggest bag.
The biggest bag. Okay, so now with the bag, right? Is it like how hefty are we talking? Are we talking like I'm gonna give you brackets.
Okay.
I'll give you brackets. Okay. So you gotta say 2.
This as a locum.
As a locum.
Okay.
Since we're talking about the biggest bag.
Okay.
All right. Are we starting between 1 to 150, 150 to 2, 2 to 250, 250 to 3, 3 to 350?
3 and up.
3 and up.
Yeah, I'll say
that's
3
a big old bag.
Yeah,
that's a hefty bag.
It's a lot of work, but you could do 3 and up.
Oh wow.
Yeah, I actually have a CRNA that he used to be a CRNA and now he's a attending anesthesiologist.
Oh come on now.
And he broke down to me how much he worked like right out of school from CRNA. Being a CRNA, and like his bag was, he was able to basically work like half the year here, and he had businesses back home, and live half his time back home.
Wow.
Yeah. He's like, yo, when I'm not here, I'm not here. I'm literally not here. Like,
off the grid.
Yeah, like I'm off the grid. Like I'm back home.
That's pretty
Yeah.
dope. That's pretty dope.
Like, and I always say, like, you could make, it's also like what you do with your money too. But yeah, if you could live comfortably. Yeah, you could support your family, like, and live comfortably.
Yeah, well, we starting threes. Yeah, we could support several families.
No. Then it gets very the math. Nah.
The math all the way with that.
The math is not gonna math. I don't know. It gets a little too much math.
Depend on the family.
You want simple math, yo. Simple math. Look at these athletes, yo. Simple math, yo. It gets a little crazy. But yo, for sure. Like you could. I always tell like nurses that that are thinking about making that investment. Oh, it's a no-brainer. Like you're not losing out. There's a lot of things you're not losing out on, like schedule, flexibility, the ability to make money, the ability to still be with your family, ability to pursue something else. The same flexibility nursing gave us is just like you got more coins to like do it with. Okay. Of course, like it comes with more responsibility.
Right.
But that's with everything. Okay. But yeah, like you could live.
Okay.
Yeah, you could live. You could live with it.
Now, for those of y'all that didn't hear, okay, the UCA part, all right? So we got a whole Haitian, okay, CRNA in the building. But thank you so much for stopping by.
No,
this is
no
so
problem.
Dope.
No problem. I think your show is dope. I think it's nice that you guys do that. I think it's a good, like, we definitely need to hit our youth to give them these options.
Yeah.
Because like, yo, that's needed for us to like move forward. That's like, yo, my like in CRNA school, I had like couples that were like in their 20s, like mid-20s together. Like with that kind of cash, y'all focus.
That's the several families that you can do with it.
If y'all focus, y'all could go far.
Yeah.
But that's a great starting point.
Yeah, no, it is. Sure is. I'm not gonna lie. There's times I be thinking, I'm like, do I want to go back to school? I can't see myself being a CRNA. I'm not gonna lie. Do I love the bag idea? Yes, I do. Yeah. However, I don't know. I just feel like for me, maybe just God has me on a different path.
Yo, and to be honest with you, like that's really what it is. Like I was telling my friend one day that this was before CRNA was even in the picture. Mm-hmm. Working as a med-surg nurse, one of my good friends, she approached me to basically have me get this job for this agency that she was gonna be like head of, right? Like, yeah, she's like she told me, oh, it was gonna be like 100 to start. I'm like, I looked at it. Was I making 100 at that time? No, I was probably making like, I don't know, like 89, 90. But I didn't take that opportunity. So that's like 10,000. I just let go of, quote unquote, because I knew that wasn't what I wanted to do. And like, although like, yeah, I'm not making 100, that doesn't mean that like whatever I'm thinking of was not going to surpass the 100. Mm-hmm. It's kind of like I didn't want to box myself in, because I had bigger plans, and I didn't even know what these bigger plans were. But yeah, like the money is nice, but you really got to consider like, yo, if you really want to do this, right? Because like I enjoy like my job. Yeah, you could say it's stressful because I'm like, yo, like legit, you are taking a plane, you're lifting off. Make sure your lifting is fine. Mm-hmm. You're gonna cruise. Après ça, you have to descend. Mm-hmm. And the descending and the waking up of a patient, that's important too. So yeah, like if you think about it like that, yeah, it's scary. But in my head, I'm like, this is like exciting. This is fun.
Yeah.
And I wouldn't know if I could do that if it wasn't fun and exciting, because that shit is very like stressful if you think about it.
There's something to be said with that. If you work in an area that you don't enjoy, it makes it so much harder. So the fact that you actually enjoy what you do,
like I
even
couldn't
though you might have
stress myself
times,
out like that, like and like, oh yeah, the bag. I'm like, because there's certain places there's certain places I've heard CRNAs they like walked out of because it was just unsafe. Because they felt like, yo, if I kept on like practicing here, I'm lose my license. So like,
wow.
and those type of places, ambulatory care center, they pay. But for them, they're like, nah, it's more than just payment. It's more so like, are we putting these patients in a good position to win and be safe while we're doing it? Question is no, then I don't care. I don't care about the bag you're giving me.
Yeah.
Like, because that bag,
you gotta work
I'm gonna have to pay for that.
License.
Yeah, and I'm like,
sure.
Yeah. Like, I love being a CRNA, but I wouldn't redo school.
Yeah.
Like, I'm good on that. I'm not gonna redo school. I'm not gonna lie to you. School was fun, but I don't. But I won't redo it.
Yeah.
I wouldn't want to redo it if I don't want to.
I feel you. I don't want to go back to nursing school. I was talking to somebody and I'm like, what would it be like if I had to retake my boards? And I cringed immediately.
Don't
like,
tell me that. Yes, I cringe. I cringe
give me
now.
An emesis bag now.
Yo.
I'm unwell.
Nah, I'm good.
Yeah.
Nah, it was the path was it wasn't easy.
Yeah.
But like I'm happy for it though.
Yeah.
Yeah, I'm grateful.
Good. The path's not easy, grateful. but worth it.
Yeah, very worth it.
Yeah.
And I know I'm very grateful.
All right, that's cool.
Yeah.
Thank you so much for being here.
No problem.
You're welcome back anytime.
It was a good interview.
All right, thank you. Thanks for tuning in to another episode of The Nurse Aspect, where we assess and evaluate. Quick question. Are we connected? The Nurse Aspect podcast is available across all major platforms or wherever you listen to podcasts. If you ever want to be on the show or if you have questions, comments, and concerns, email me at thenurseaspect@gmail.com. Follow me on Instagram at The Nurse Aspect or on TikTok at The Nurse Aspect for nursing nonsense and more. Until next time, nurse on, assess, and evaluate. Omega XD.